Biologists analyzed in the laboratories fragments from ancient altars covered by sandstorms or volcanic ash. A surprising result caught my attention. Along with the fragments of the sacrifices, which sometimes also contained human remains, there are traces of plants with psychoactive effects. In fact, traces of drugs. The smoke of these plants produced an euphoria to those present, which they believed was due to the goodwill of God. The priest lied on purpose while breathing the smoke from the altar installed addiction. Gradually, the repeated return to these altars brought enormous financial income to the priests. Nothing new. And today, drugs offer the illusion of getting rid of problems, promise a false state of well-being, install addiction, and begin the gradual destruction of the body and the mind. Drugs destroy lives and ruin families. Welcome to Steps in Recovery, a program where we want to bring hope to people who struggle with addiction and their families, and also to raise awareness to factors of responsibility in society in order to let them know how they might help in preventing development of addiction. I am MargiAnne, and from Loma Linda Springs studio, I have the pleasure of presenting my guest, Marissa Partee. Welcome back, Marissa.
Thank you. Thank you.
Marissa is an addiction counselor and also behavioral health specialist. She has a lot of experience in recovery. We'll continue today discussing about the appropriateness of integrating family counseling in situations when patient struggles with substance use.
So I see a lot of times clients can be hesitant because they're not sure where their information may go after sharing it in a setting like counseling for addiction. That lifestyle just comes with habits of secrecy. So it's difficult for a lot of clients to be transparent, be vulnerable, share the details of their addiction. But confidentiality is key to all those settings. So that confidentiality component that we promote a lot of times in treatment helps the client feel safe and comfortable in sharing really important information we're going to need to help them. But when it comes to when it's appropriate to disclose, when it's not appropriate to disclose, I like to discuss that right off the bat with the client so they understand there are still limitations in confidentiality. A lot of times we let that client know that, confidentiality may have to be broken if somebody's at risk of danger or harm. That could be themselves or another person. And I think it's important to kind of break that down to the client to also have them become aware that self-medicating and using substances is a form of harming self, especially certain choices of drugs that they may be putting within their bodies. So I start to have that conversation with them at the start of meeting them so they understand, yes, this is a place to share what you need to. It is confidential, but there are limits to this confidentiality. So if I know that you're using substances at higher amounts, if I know that your choice of substance has a higher risk of overdose potential, like fentanyl, I let them know, like, I will have concerns if I have that insight, and we will talk about that and what that would look like with maybe involving their family, helping them talk to their family to let them know where they're really at with their use.
Yeah, interesting, because I was thinking about confidentiality and discussing with parents when we have our client is a teenager.
Yes.
And we have in our ethical issues saying this is something not to be disclosed. We keep confidentiality if the client discloses some addictive behavior. Let's say parents have no clue about. And now with the emergence of new substances like fentanyl, you can use
a very small amount
and die because
yes.
it's deadly. Maybe we need to rethink what is about confidentiality when we work with teenagers, and this is something they might understand. This is self-harming.
It is. It's still a form of attempting to harm yourself at a very extreme, dangerous level. But that's my opportunity as a professional to educate that person on how that is still self-harm behavior, right? And how it's at a level of life or death. So one of the tools I use, it helps me first focus on the family. So I will meet, if I have a client at that age, I will meet with the client and their family. There's a certain amount of questions that are targeted based off the family situation. And after that first part with the family, I do have the family step out, and this then allows me to talk to the individual in person alone, to really start practicing, okay, what's going on that you may not be willing to share with everybody in the room right now? Let me help you. But in order for me to help you, I have to know what's going on too. So it's a lot of reiteration, a lot of motivational interviewing skills to help them put in their issues in their own words, in their hands, while I'm just there supporting them during that process.
Yeah. We know there are all kinds of situations, and people turn to drugs because there are some issues in the family, and sometimes it's not appropriate to have family-based intervention. We'll try to focus a little bit on these particular situations. What can you tell us?
I did have a case very similar to these circumstances, which was interesting how it started, being that one of the parents that were in the dynamic was concerned for their minor, so they brought them into the clinic for services. So of course we did that approach where we meet the family first, and then we have the family step out, and then we start working with the client individually from there, periodically with the family. But that time with the client really allows us to get the information we're going to need to know whether or not is there a history of violence, if we were to continue involving the family, is it going to be more harm towards that client? And this was one of those situations. There was violence in the home, and I would have never known the details of that without just working with the client periodically as well, and building that rapport where she felt comfortable letting me know there's a lot of violence in our home. And, this is why I'm nervous and very angry, and I'm self-medicating and numbing myself because of the situation between my parents. And that helped me recognize, okay, from now on, I'm going to solely start just working with the client a little bit more, and then I'm going to get other services in place for the other members of the family. So that way it wasn't a conflict of interest knowing that information. And then, of course, it always comes down to collaboration. So getting that information, I can't keep it to myself. My next step is always, it's those limits of confidentiality. I have to go let everybody that's a part of the treatment team kind of know, to help me approach it in the most effective way that I may not have been able to just by myself with that information.
Here it was a situation when it was a client, like a teenager. How are you working when there is family violence? We talk about partner violence.
Yes.
Because this is another dynamic.
When I get information on a case that's very sensitive with domestic violence, partner violence, anything that's going to do more harm in the household, if we start working and exposing some of that stuff, I like to bring in more resources. So a lot of times I like to refer anger management classes and sessions to help them recognize the dangers that their anger is elevating and escalating to give them a chance to work on it. So I always start linking other alternatives to help me educate that individual to keep it safer, and to pour knowledge that may be necessary for the case.
Yeah, I'm moving toward, again, like the collectivistic culture when they want family together in the same misery, because if I'll disclose something, maybe...
Yeah, things can get very...
Something worse can get...
Dangerous. Yeah, and this is where making sure that I don't keep that information to myself is very important, so I let the treatment team kind of aware of all the details so we can collectively decide what that next step would be. Is that something that, like if an adolescent's involved, do we have to go ahead and report that because now the child is in danger? Those are those code of ethics we have to follow, but we have to tread very lightly, and our next step has to be very strategic as a team. It's a team choice and process with that.
Yeah, and the point will be have the client in mind and don't aggravate the situation.
Yes.
Because we might lose client who say, I came there, you disclosed too much, now I'm going back home, and the situation is worse. Our client is in, the program is in detox, let's say first week, second week, and the family pushes with, we really want to have start therapy because we really, really need to be with him or her support. What is the risk of family-based intervention? Where are withdrawal symptoms?
When withdrawal symptoms are present, it's a very sensitive state that person is in. This is what they were avoiding when it took sobriety efforts. They were avoiding the withdrawal symptoms. So aggravating them in that state is very dangerous. So what I see a lot of times for many programs, so let's say a residential program that starts with the detox process, they have a no contact approach. They won't let families contact that individual for 30 days because they've recognized the impact that some clients have or what they go through when the families are involved at an early stage. So they like to take that time to help that client first get through all of the symptomology that they're experiencing so that they have a chance to understand kind of what was going on to then actually work on anything. Confronting can be a lot.
It seems like really, really harsh to let the person not to interact with the family for 1 month.
Yeah, I know. A lot of clients struggle too because they're so used to their families being involved and they're in a new place. They don't know anybody. They're alone. This is a very strange moment. They're detoxing. They don't want to not be in connection with their family, and I understand that. But that's that moment where they really need to focus on themselves and do what they can to heal themselves from everything that they're feeling for at least 30 days so that they have a chance to really get some things done when they can talk to their family. Because otherwise I see it just intervene and do a lot of harm, and it's disruptive. And then it takes or it prolongs that individual to really get in a healthy place to do therapy, to be in a family setting talking about some stuff. Otherwise, it's very dangerous.
Yeah, I'm just thinking of wilderness program.
Yes.
Any?
You know what? I actually enjoy the idea of a wilderness program.
What is this about? Now we don't have something like this.
So in certain states only allow it too. Like California, we don't allow wilderness programs. So there's a law in place that will not allow it, but Arizona allows it, Ohio. So there's certain states that do allow it. So the wilderness program it's a very specific kind of treatment approach. It takes away everything that a client may be used to, which comes to terms of technology, housing. I mean, bare minimum. They have basics, so they're out in the wilderness, and they're learning survival on a different level to condition them, to help them when they go into that next stage of recovery, to amplify their success, because they kind of go through an assimilation of what it's like to have nothing. And is that something that they really want to go towards, where they're out in nature trying to survive? We're human beings, we're advanced. We don't need to survive in nature like that.
It's like a new birth.
It is. A lot of times I've seen clients either hate it or love it, but the clients that I see actually love it, their success is noticeable. The ones that hate it, their resistance is still very strong. I mean, they also hated the next step of the process of recovery, so it's more of just that natural resistance of whether or not they're ready for what it would take for a life of recovery. And then there goes, okay, what are they dealing with cravings and all the biological stuff, the symptomology of, the disease of addiction.
Yeah, I had a client who said, I'm so glad I did it because I learned so many things. And I remember the client getting the job right away and being very, very reliable, dependable on the job. And when I talk with the mother and father, highly educated people, they said, we were there and visited him and we barely survived one night.
Yeah, I could assume it's very challenging. I would imagine it is, but there's something about that approach for some individuals that thrive off that opportunity to live life that low and still make it and get through the next day and go through the whole program and then get another opportunity to what their normal life was, to have more appreciation for it.
Yeah, and just to underline this idea, when the client is in his first month of recovery, it's better not to have contact with the family, and then they'll have plenty of time because he learned about self.
Yes.
And
it gives them a chance for a lot of introspection, which is vital to recovery. We have to understand what caused us to use, why we were still using, what started it. We're not going to get that chance if we don't have that alone time. So like a lot of my clients that struggle with that, where they're like, no, I need to call my mom, I need you, they become very demanding. Those are the natural behaviors of addiction, the demands. I remind them, you're going to, and I suggest, why don't you write down everything you need to say right now? So when you have that chance to have that next talk with them, you'll have that reference and you won't feel like, man, I didn't get to tell them when I needed to. No, you still did. Just put it somewhere. And then it's also a healthier approach because then they're not impulsive with whatever their delivery might have been. It makes them rethink, okay, was this something I really needed to share with them, which is healthy behavior finally.
This is interesting because you pointed this intervention for the client, and the same you will tell the parents. We keep saying, oh, we need to check with him.
Yes.
We want to reassure him, we love him, we appreciate whatever he is doing. I say, okay, your practice. And sometimes there will be the same intervention for client and for the parents, and when they'll get together.
Yeah, because a lot of times the similarity is the parenting, and then that person is learning how to also reparent themselves too. So it's a lot of just relearning things, doing things differently, because a lot of times we say in recovery, nothing changes if nothing changes. So that's where that change starts.
Yeah. Difficult situation when parents struggle with a mental problem and they don't take medication. They are against medication.
Yeah.
Any situation, if you remember a particular client in your caseload sometimes when you had?
I do see this in many instances, untreated mental health issues. A lot of times we see it in the parents that were raising that child that then, learned habits within their life, which then became addiction prevalent. But all we can do is keep reiterating and redirecting them to the right professional, right?
Yeah.
Reminding them how vital it is that they have things in place in their toolbox for when they're going to support their loved one that's battling with addiction. So reiterating, going to get seen by a therapist and getting them their own help during this time as that person is as well. Because otherwise what's going to happen is they're going to get involved in very unhealthy ways, and again their mental health issues are being untreated.
Yeah, and situation when the family was really, really toxic and parents want therapy, and we prepare the client to have like an emotionally detachment from the situation, because otherwise it won't help, and we encourage them to develop their family in recovery.
Because that's where our focus is when it comes to that. It's going to come down to the client, right? And helping them during that process while, their parents might need that time to also work on themselves. So being there for the client so that they know to start practicing their boundaries, right? Letting them practice hey mom, I can't do that, hey dad, I can't get involved. So it's creating and it's starting that practice of healthy behaviors in the dynamic. But somebody's got to do it. Sometimes it is the child in that dynamic.
Yeah, and again, from experience, it was very sad to help client learn to accept the situation that his parents won't be there for him, and he need to rely on a recovery family.
Yes, and that's why the recovery family can be vital, because some of us, when we come from a dynamic where it's just toxic in so many different levels, but we're willing to do the work for ourselves, we rely on our recovery family, right? Because we don't have the other people that other people may have in their lives to support them. So it's hard for us to call those people when we're struggling because we know that they're going to be struggling just as well. So is it really going to help us? So those people in our social support group become our family. You know, we have a new sense of family, but we have the support we never had. And that's why it's important to have those people in place because not all of us were born into that setting.
I remember one of my clients, she was an autistic, highly functioning autistic, very highly educated person who said, nobody, just my sister in recovery. I don't have a sponsor because of her autistic issues, but she said, I have 4 or 5 sisters in recovery and we enjoy life, and she keeps sobriety and supporting other people.
Good.
But the point is stay in the family.
Yeah.
Could be recovery, could be...
Stay connected. Yeah.
Stay connected.
That's a protective factor. Our family is a protective factor to battle against these things.
Yeah, there is a lot of hope when people realize the details because they help understand it's nothing wrong with them. It's about the environment, and when you change it, they need to change themselves all the time. Something about helping family understand the role of preventing. How you help parents who are so scared their children are around people or peers who use substances. What would you tell parents? And I know in Romania we have a lot of things going on with substance use in high school, or I don't know if probably lower, but I might say people struggles with like fear. What if, what you might tell them?
I think what's a really healthy approach, and I've seen it pretty successful with that age range, is learning how to have, well, number one, making sure it's healthy, but open table discussions about some of your concerns and having a very specific approach so that the adolescent understands that you mean well and you want best for them, and your duty is to help guide them at their age, but to have that open discussion so they understand that if they do have questions, that you are a safe person to come and talk to. Otherwise, what happens is they're going to go to their maybe dysfunctional friend group or other alternatives like early substance use or exploration. So I think it's important to just have a safe net on those conversations at home, but have a very healthy approach and letting the adolescent know, these are my concerns and I'm a little worried, to help give them a chance to clarify any of those fears that might just be also out of our own insecurities or irrationalities. But starting the conversation is always helpful for early intervention.
Just talk with the whole family.
Individually, sometimes together. Learn how to make some of those topics like drug use a comfortable discussion rather than it being so uncomfortable that they're not going to come to you if something's going on. And they're going to be more pushed towards these unhealthy friends because they might be self-medicating out of the stress and the pressure.
We have here in the United States this medically prescribed marijuana. And I have clients who said, my grandma uses, and you said, I don't need to, I don't have to. What you tell the parents when you have a situation like this, because they have the grandma in the house, they have the teenager, and they are in the middle.
So, the advancement that marijuana has had in our culture, I mean, I'm sure nationally at this point, I like to call it now marijuana maintenance because a lot of people like to utilize, it's legal, it's safe, all of their justifications. Mind you, so is alcohol. Okay, so is alcohol.
Mm-hmm.
It doesn't mean that it's not going to cause you issues or amplify your issues if there's something wrong with your mental health, if you have a trait of addiction. So it's a very dangerous justification. I know I've had a lot of clients, their main drug of choice might have been something severe, right? And they're clean off that. But they're still using marijuana. And I just had a case like this very recently. It's still not going to give them the appropriate chance to really work on the cognitive stuff. The restructuring, the CBT approaches are not going to be effective because a substance is still in place. Marijuana is still distorting their perception. So it's going to be really hard for them to get the appropriate treatment. And what happens is they prolong complete sobriety. They wait for the next crisis, the next rock bottom, but now it's because of marijuana use, right? And then they recognize, I never gave myself a chance to actually be sober to really work on this stuff. So it feels like they're back to ground zero.
And this is one of the ideas that for teenagers, maybe you need to go to the reduction of the quantity and you don't need to go to abstinence.
It's really scary with the teenagers right now because teenagers don't have limit capacity. It goes to where they're the developmental stage they're in right now. They're naturally high risk takers at their age. So thinking that they're going to be able to limit and control their use, it's not going to happen. That's why we're seeing even marijuana dependence in high school age children now. And the quality of what marijuana is, it's not what it used to be. It's not. It's man-made. There's more chemicals. That's why we're seeing even more rates of psychosis connected now to marijuana use. Who would have thought, for everything they promoted marijuana to be, that it's causing psychosis now too because of the quality of it. It's a higher grade. It's a different high, and it's not what it used to be. So it's hard for these adolescents to control any of that.
Yeah, better stay away.
Just stay away. It's too risky. You're more than likely going to gain dependence on it.
Thank you so much, Marissa.
Yes.
It was so insightful to have you.
No problem. Thank you.
We are glad that you followed our dialogue today. On our part, it was a way of extending a helping hand to those who listen to us, presenting recovery as a serious, logical, scientific, and a very possible action if it is followed step by step. If somebody from our audience, a young person or not just young person, considers starting exploring using substances, I tell the person, look for something higher and greater. Find your life meaning and connect with God, who is the supreme provider of happiness, and you'll succeed. I am MargiAnne, Isaia, and together with Marissa Partee, we want you to get the best for your life.